Hello everyone, today we are going to talk about double eyelid surgery. Do you suffer from an absent or natural fold in the upper eyelid between the eyelashes and the eyebrow? Are you looking for a cosmetic surgical treatment for this problem? Monolids tend to be more common in Asian communities. Some people with monolids seek double eyelid surgery to create a more westernized eye appearance. Double eyelid surgery is one type of blepharoplasty that typically involves only the upper eyelid. In this video, we'll explain to you everything related to double eyelid surgery. What is it, how is it performed, and the expected result of the operation, as well as the possible complications. Our role today is to answer most of your questions regarding double eyelid surgery. Today, we have Dr. Park, who is a leading doctor at Topclass Plastic Surgery Clinic. He is going to discuss with us everything related to double eyelid surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. 안녕하세요.
네, 안녕하세요.
Hello, Dr. Park.
Yep.
So can you please introduce yourself to us?
Hello, I am Soon Joon Park of Topclass Plastic Surgery Clinic.
So come to our first question about double eyelid surgery. At what age can a patient have double eyelid surgery?
네.
Medically speaking, eye surgery can be performed regardless of bone growth. However, local anesthetics need to be injected and oral medication has to be taken periodically. Therefore, I deem it adequate that the surgery be undertaken after a certain age, and most importantly, it would have to be after when one can fully realize the change that will happen to their appearance. Personally, I recommend it after getting into middle school.
So is it helpful to take any celebrities photos during consultation?
네, 실제로 제 환자분들 상담하러 오실 때 연예인이나 SNS상에
It is quite common when my actual patients come in for consultation. They bring photos of celebrities or influencers. Some don't because they feel shy or awkward. In such cases, I always ask first, did you bring any photos? Or do you have a specific celebrity or any famous person in mind that you prefer? When they do bring a photo, I focus on how thick the double eyelids are, where it starts, how much the pupils are exposed, etc. And they talk with me, often looking at the mirror together. I tell them if they want something different from the photo, and explain some things that would be impossible. Then we move on to plan a surgery date.
So can we make a more defined double eyelid by using non-incisional techniques?
예.
Yes, it is possible, unless the skin is extremely thick and resistant. It is doable. I'm not talking about the simple buried non-incisional suture method when we perform natural adhesion double eyelid surgery. It is not only the tensile force of suture that supports the eyelid, the induced adhesion between the skin and muscle also contributes to holding a sturdier double eyelid structure, which helps make the resulting eye bigger and glamorous.
So are there any methods to make droopy or sleepy eyes look bigger?
예.
When someone has droopy or sleepy eyes, lid ptosis is mostly the cause of ptosis, which occurs when the muscle responsible for eyelid opening is weak, or when the skin is saggy. Ptosis correction to adjust the muscle tension can improve when you look straight forward, and the eyelid covers over 1/3 of the pupil, or there is too much fat or the skin sags. It is adequate to perform incisional ptosis correction to organize the sagging skin and fat and pull the muscle. Many ptosis patients' eyes are also accompanied by a sunken area above the eye. In that case, taking fat from the stomach or thigh for fat transplantation can aid the needed volume in this area.
Okay, so everyone cares about scarring after the surgery. But why is it some scars are really pronounced, and are there any ways to take care of them after the surgery?
네.
Abnormal scarring such as keloids and hypertrophic reactions rarely occur in the eyelids or anywhere around the eyes. However, due to individual skin differences, when excessive scar reactions do occur, it could be in the form of swelling or color change or itchiness. It is relatively more common during revision surgeries, especially if using an incision. The surgical technique is also an important factor. I try to minimize the tissue damage and operate on only the required locations. If the patient is still worried, there are measures to alleviate scar reactions, such as anti-scar ointments, shots, treatments, etc. For ointments, you can apply it 2 to 3 times a day after washing your face for a month. If the scar persists even after a reasonable period, injections or laser treatments are also an option.
So what kind of anesthesia is used during the procedure? And when should the patient come back for stitch removal?
쌍꺼풀 수술을 하면은 수술 중에 눈을
When performing double eyelid surgery, we have to check any asymmetries that occur while blinking or pupil exposure, which is why the default option is local anesthesia. Most stay conscious and are able to hold a conversation with me, but to minimize any discomfort at the beginning of the procedure, or occasionally when we use invasive measures such as needles. General anesthesia is chosen at times. Stitches are removed anytime from 3 days to within a week.
How many days should the patient spare between laser vision correction and double eyelid surgery?
Vision correction is quite popular these days. Due to the pandemic, there has been a surge of home offices and long-term vacations, which has increased demand for laser vision correction done simultaneously with eyelid surgery. The order is not important. I would advise a 1-month term between the two. It would be for the better if laser correction is done after the swelling is gone from the eyelid surgery, and if it is done the other way around, consult the operating optometrist before performing eyelid surgery or any type of eye surgery for safety.
Okay, so Dr. Park, what is the most successful eyelid surgery method in your opinion? And are there any things that we need to be aware of before getting the surgery?
Some eyes or double eyelids that one thinks looks nice may appear awkward or unnatural on the person in reality. So I advise consulting an experienced surgeon beforehand rather than think alone. I think that will help with coming to a decision. Generally, I can propose the ideal method that suits the patient in a given situation after consulting them. So I deem it desirable to move on to surgery after the type of trust is established.
So that's it for today, Dr. Park. Thank you so much for answering our questions today. Thank you.
Thank you very much.
So today we learned many things about double eyelid surgery, and the doctor explained in details everything related to this cosmetic eyelid surgery. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below. We respond to you as soon as possible.